Hi everyone. Today I'm going to talk to you about one of my other invisible diseases called endometriosis, or endo for short. So let's jump right in. Endometriosis is a disease of pain. But before we can talk about where the pain originates from, I do have to do a little bit of an anatomy review. Please don't fall asleep. So inside your uterus is something called the uterine cavity. And this is exactly what it sounds like. It is a cavity, but it's lined with very special cells called endometrial cells. And it's these endometrial cells that function to help support a pregnancy. Okay, so help support the baby. And if you do become pregnant, then the baby will develop in this uterine cavity. And these special endometrial cells will help to make sure that the baby is well supported. Okay. The issue in endometriosis is that these endometrial cells somehow leave the uterus and go traveling around and mostly get implanted in the abdomen and pelvis on different structures. So I do want to tell you though that these endometrial cells, they're pretty savvy. They have been found actually as far as the brain, which is pretty much as far as you can go. But mostly the issues are in the lower part of your stomach. These cells actually implant on different structures. So no structure is off limits. These savvy endometrial cells can implant on any structure. So I'll just use the intestine though for my examples today. So whether the endometrial cell is inside the uterine cavity where it's supposed to be, or whether it's on your intestine where it's not supposed to be, these cells are still under the control of the normal hormone fluctuations that happen during the menstrual cycle. So ladies, whether you want to be pregnant or not, every menstrual cycle, your body prepares for a possible pregnancy. And these endometrial cells, again, whether they're outside of the uterus or not, are still going to respond to these hormones. So how the endometrial cells respond to these hormones are they actually build up, so they become thickened, right? So think about supporting a potential fetus. After your body realizes that you are not pregnant, then they shed. And that is actually when you bleed. Okay, so menstruation, that's when you bleed. So these cells, that lining is shedding. So that's all fine when it's in your uterus, but now this implant on your intestine is now going to try to shed, try to bleed. And this leads to a vicious cycle of inflammation and pain. The blood gets trapped and scar tissue forms. And the scar tissue is another reason for pain, as well as other issues like infertility, or many women unfortunately develop blockages in their intestines. So, I think it's up to 50% of women that are infertile, that have difficulty getting pregnant, actually have endometriosis, and the scar tissue just strangles these structures, inhibiting a pregnancy. The term endometriosis was actually coined in the early 1900s, although there are many reports of documented cases of women with severe pelvic pain as far back as even the Egyptians. But really the 1600s, there's a lot of reports from this time period. I mean, sadly, we still only have theories about why these endometrial cells get out of the uterus and go and plant in other structures. We really don't understand the disease, and as you can imagine, there's not very many good treatments. Women's health issues are not validated, and endometriosis is just another example of this. I had a video a few weeks ago on Sjogren's, my other invisible disease, And it sounds very familiar, this whole gap of knowledge, gap of research, again, leading to limited treatments and limited understanding. And it really is something that needs to change. 1 in 9 females assigned at birth will have endometriosis. I mean, that is an extraordinary number. Extraordinary number. And there's still such a stigma. Many women are lifelong sufferers with endo. They start having severe pain when they begin menstruation, in their early teen years or before. And this pain can continue into menopause. I get so upset when women share their stories about how their gynecologist has told them painful periods are normal, just put up with it. That is not the case. Your period should not be extraordinarily painful. If your gynecologist is telling you that it's normal to have severely painful periods, that is wrong. It is not normal. This is bad medicine. And it's an example of medical gaslighting. Your provider not taking your concerns seriously, dismissing you. It took me 6 years to get properly diagnosed with endometriosis. And I saw 4 different gynecologists. You know, the statistics show that women will have to see 4 to 5 different gynecologists before getting diagnosed. And the average age for diagnosis is actually in the 30s, even though many women start having pain when their menstruation starts. This is unacceptable. Really unacceptable. And another example of how women's health issues are not validated in this country. Endometriosis is so much more than painful periods. So much more. The effects of endometriosis are very significant in all aspects of your life. So your work life, your home life, your relationships, your social life, economics. Many celebrities like Lena Dunham, Dolly Parton, Daisy Ridley have come out with their endo diagnoses, which is great, but we need so much more as far as awareness. And we need a culture change. Women's health issues need to be recognized. We can start by first, never dismissing our own pain. If you know something is wrong, keep fighting, keep pushing. See 4 to 5 gynecologists. If you know something's wrong, don't ignore it. Don't ignore it. Even if you saw 3 professionals and they told you nothing's wrong, this is normal. Keep pushing for answers. Never give up. There are great medical providers out there. And if you need help trying to find one, I have some videos, I have information on my website. Please use my resources, email me. There are great medical providers just waiting to help you, waiting to listen. Don't just hide the pain. Never give up. Thank you so much for listening. Please like and subscribe for more content. And my next video on in this invisible disease series will actually be an interview with another individual who has invisible disease, so you won't have to just listen to me talk. It'll just be a really casual discussion around my kitchen table. But thank you, and please be well.